So in my last video, I talked a little bit about my wrist fracture. I had a compound fracture on the distal radius bone, extremely painful, and I broke it in several places. I was out rollerblading at the skate park, came down really, really hard, and anyways, as you know, anytime you have a wrist break, it's extremely painful, and I had to go to the hospital. They had to reset my arm, and then a week later, I had to have surgery. And in the last video, I talk about that surgery and how painful it was and some of the things I had to do to help with the recovery process. I'm now almost 3 months out from the surgery, so I want to talk a little bit about the things that my doctor and my physical therapist told me to do to help with recovery. So here's just a quick shot of here's my X-rays. So you can see here that, sorry about the light. I had about 13 screws and a plate put into my wrist. And here's another shot of it. I don't know if you can see that okay. But I gotta tell you, after surgery, when I came out, my arm felt like it was on fire. It was very hard to sleep for the first month. It's really hard to get comfortable. Plus, your arm, at least for me, it felt like my arm was on fire. That's the best way I can describe it. I was in a ton of pain, and because after surgery, my fingers and my hand was so swollen. I mean, my fingers looked like sausages. And I also couldn't move my fingers because everything was so swollen that they had me put my arm into like this foam block to kind of keep my arm up and elevated to help reduce swelling. Extremely painful. The thing my doctor told me right after surgery is that it's super important to get your fingers moving. And when I came out of surgery, I could not move my fingers. My fingers were like in a claw, like basically like this. They just weren't moving, almost like a claw. And my doctor's like, you really have to start to get movement in your fingers. So force your hands to close. So basically, for the next week, I was just doing this every day with my fingers to kind of get some movement. And as the days went on, I was soon able to move my pinky first, and then my ring finger, and then my middle finger, and slowly my index finger. And then my thumb took the longest to kind of get moving. And I gotta tell you, it's like super scary in the very beginning because you feel like, oh my gosh, am I ever gonna move my fingers again? Because everything is so swollen and you don't know like the results of the surgery or tendons damage. Like you just don't know. I talked to my doctor about all this. My doctor's like, everything should be working. It's just gonna take some time. So if you're feeling like I did, just be patient. Keep moving your fingers. Keep moving your fingers. So, anyways, this is my hand. This is my hand that I was working with. And you can see here's the surgery scar. And it looked really bad initially because they had to, I had stitches, had to have them removed. I had the cast on for about close to 6 weeks. I had a full-on cast. That was one of those full-on arm casts from here down to here. So when the cast first came off, it was actually hard to even extend my arm. It's crazy how just keeping your arm like this in a cast for 6 weeks makes it difficult to stretch out your arm. But on top of that, because of the inflammation and the pain, when the cast came off, I still had a fracture, but the doctor was like, it's okay that we take the cast off because you have that metal brace literally nailed in or screwed into your wrist. So they wanted me to get my wrist moving as quickly as possible to help with recovery. So the first thing that my doctor said to do after I got my cast off, and again, this is, I think 6 weeks right after surgery, they take the cast off. It's super painful. Like your arm is still in lots of pain. And for me, it was still fractured. But the doctor was like, you really have to start to move your wrist. So the exercise that the doctor told me to do was basically take my wrist and begin to just move it right to left, right to left. In the very, very beginning, I could barely do this. It was like this, just just like this. And and that's what he told me to do. And so I took that advice, and pretty much, I got to tell you, like every hour, I was just moving my wrist back and forth to get some sort of movement. About a week later is when I went to go see my PT. And I'm very grateful to have a physical therapist. The physical therapist had me work on a couple different things. The first thing she had me do was to move my arm like this, like in this position, and then basically just not passively, actively move my wrist left to right. That was the very first exercise that she had me do. So whereas my doctor wanted me to, use my left hand to move my wrist like this, the PT didn't want me to do any sort of force at this point because my arm was still healing. So she preferred that I just keep my arm like this and go left and right, left and right. And she wanted me to do that 3 times a day. And I was doing that almost every couple hours. Like I was just like wanting to get movement as much as I could. And so when I'd go on walks, if I was in the car, my wife's driving, I was just sitting here doing this constantly and just wanting to get movement as much as possible. Then on top of that, she had me do some other things where to get movement back in my fingers. Like I said, after surgery, my fingers were kind of like in this claw form. That's the best way to describe it. This is the way it looked, and it was very hard initially to get movement in my fingers. Like I said in the very beginning, I was using my hand to close my fingers, right? For whatever reason, and I was talking to my PT about this, I had better movement with the fingers on this side. So starting with my pinky, I could move my pinky pretty easily about a month after surgery. And then my ring finger and then my middle finger. My index finger actually had some issues curling, but as you can see, it's curling much better now. And then my thumb took the longest. And in the last video, I think I was showing you like it was doing this, like I was able to do this, but it wasn't bending. Well, now it bends. Now it bends. And so the other exercise that my PT had me do, aside from doing the left and right motion, was also doing this. And I got to tell you, the first time I was like, I don't think I'm ever going to be able to touch my fingers like that. Like I could do it on this hand, But when I was first like, oh my gosh, I was like sitting here like this, like looking and staring at each finger, like trying to make the connection. And it took me a lot of time. So I just say, just be patient with yourself, be gracious to yourself because it does take time. But by practicing, you will get there. And I got to tell you, like this one, like touching my pinky to my thumb was like the hardest. Like I would get to this point and I was like, this is as far as I can get. And then I would force it to get it to touch. But I just kept doing that over and over and over again. So depending on what your doctor says and depending on your injury, I don't know if these exercises will be helpful to you, but these are the ones that were helpful to me. So again, left to right, exercise 1, doing that at least 3 times a day. The more, the better. And then doing the fingers and just doing as best as you can. Just do as best you can. The other thing that she had me do was to do like this curling motion to get movement in my fingers. So again, they were very stiff after surgery. And so she had me like curl from the top and come down all the way like this. And then you come back up like this. Almost like, I don't know, a caterpillar. I'm not quite sure how to describe this motion, but basically you're just kind of curling. And this did take me a lot of time to get to this point where I can actually do this because it was very painful and my fingers were stiff and I couldn't quite get them all to sync up like this right now. It did take me some time, but she wanted me to practice doing this over and over again. The other thing that she had me do 2 weeks after I started PT was to begin some strengthening exercises. And she encouraged me to get some clay, and this is just it's called power putty, and this is what it looks like. Um, it's basically just like a little bit harder than Play-Doh, you know. So I'm not sure what you have access to, but it's essentially like a harder clay that's made for, um, and it's like a medium. This is a medium level, I guess, not super firm. But basically, she would have me sit here and roll out the clay with my right hand, and then begin to just kind of use my fingers to kind of crush it a little bit, to kind of get some to start to strengthen my fingers. So, and that's something I would practice in my physical therapy. She wanted to see how I could do with folding this. And then there's another one where you kind of make like a duck motion like this. We're kind of beginning to strengthen this area by just rolling the ball up and then doing it this way. I'm probably not doing it exactly. If my PT was watching this, she's like, "You're not doing this exactly right." But basically, you want to kind of almost like a duck. You keep your arm like this, and you kind of just begin to crush. And it does hurt. It actually does hurt. Um, but I can tell you that by doing all these exercises and really being committed, and it does take a lot of patience, a lot of time. I have gotten a lot better with my mobility. And just this last week, the doctor said that I can now begin doing some light weight training. So I began to do some wall push-ups initially by going up against a wall and just kind of pushing out, and then slowly working on being able to get out of a chair, which still hurts, by the way. It still really hurts on my right hand. Oh, something that's practical for any of us that are have to work on a computer. So what I noticed is this scar, it just hurt. It's super tender. Like it's still really, really tender. And so she recommended that I get some, there's like these scar bandages that you can order. It's like almost like a tape. These big bandages that are for helping to heal scars. And actually, I think I have a box here. Let me see. Oh yeah, here we go. It's called Scar Away. Anyways, you can go on Amazon. They're basically silicone scar sheets is what they are. I didn't care so much about the scar, but I do care about like the tenderness. Like it's very, very tender, and actually it hurts. And she said this would actually help with the healing process. So I got these scar sheets. They're pretty cheap, and I cut them up so that it fit. It was like very narrow, and taped them there. And you basically put them on at night, and you can actually reuse them a couple times. So that's what I did. And then during the day when I'm typing, like I said, I couldn't really get comfortable. And oh yeah, so typing is actually good PT, like good physical therapy, because you're actually getting your fingers to move. And so I wanted to get typing as soon as possible, but it's almost impossible to type when you have a cast on, because the cast is really heavy and it's just really uncomfortable. And I couldn't quite type when I had a cast on. And when they gave me like a, when I finally had it all off, I was able to type, but it was then painful because of the scar. So my PT recommended like putting on like this sock. So she gave me like this really cool kind of cloth material with a hole for my thumb. So, and it's almost like a compression sock, and you can literally do this with any sock. So basically, I put this on when I'm typing, and what's nice is it's almost like a little gentle hug against your wrist, gives you like a little bit of support, which is nice, but more importantly, it protects the scar from irritation. So when I sit here and type now, I'm not getting that pain like I was getting before when my scar was rubbing up against the desk. Because you know, when you're using a mouse and moving things around or typing, you're rubbing up your wrist against the desk, and that can cause some irritation. So depending on where your incision is, that can cause some pain. But if you get like a cloth, a sock, or you can even order online like wristbands to help cover up that scar when you're doing something physical that's going to be rubbing up against it. It can totally help you. So anyway, so that's where I'm at. I got to tell you, I'm feeling so much better, especially because the pain level has gone way, way down since the beginning. Um, again, the surgery was almost 2.5, maybe 3 months ago. And whenever I went to the doctor or to the physical therapist, they would say, like, how's your pain level? And I would say, like, oh, on a scale of 1 to 10, at nighttime, it feels like a 3 to a 5. Um, but then during the day, it might be sitting around 1 or 2, just constantly. Well, now I'm at the point, 3 months out, where there's no pain during the day and or at night. The only time I get pain is if I'm doing something that is, or I'm adding weight, excessive weight to my wrist. So if I'm like getting up out of a chair, I'll feel some pain. If I am using a can opener, that's extremely painful for me. So I'm still like, I have to work on building up strength. And like I said, in the very beginning, when you first got a cast off, like everything hurt. Like trying to use a toothbrush again, trying to use a pencil, like anything you're doing with your right hand, or anytime you've injured your wrist, any activities that's like using those muscles, it's gonna hurt. And you just have to be patient with yourself and keep trying, keep working at it. And like I said, I was doing these exercises every day, like almost every hour. Anytime I was sitting down watching TV, I would just sit there and just, be moving my wrist. Another thing that was really helpful that the PT did was massage around the incision. So just massaging the area. And I would say that, and I'm still doing that by myself. I would say, like, as you're healing, and if your PT or doctor gives you approval to go around the area and massage yourself, that could really, really help with getting blood flow going, to help reduce, again, that inflammation, and also just to kind of help with the healing process. So I'm still doing this all the time. I'll sit there and I'll just massage this area. And my PT gave me the thumbs up to go biking. So I actually went mountain biking this last week, and it felt so good to be back on the bike. Yes, it did hurt when the handlebars were vibrating, but I had the strength to be able to brake no problem. I was just more careful on the trail. I went on a trail that was not super steep, that was more flat, and it just felt good to actually go back to a normal activity. I am planning on getting back on rollerblades. I'm just going to be on the flat. I'm not going to be going on ramps on rollerblades anymore. I'm going to be super careful. And when I do fall, I'm going to make sure I have elbow pads so I do fall like this. But I do believe that I'm going to come out stronger from this experience. I'm going to be doing, I'm already going back to the gym and doing some different types of curls and things like that, lightweight, just to kind of build up the muscle. But I already feel like I'm coming back. And I want to encourage you, if you're going through a lot of pain right now, know that it will pass. And just stay positive and celebrate all the little wins along the way, because I got to tell you, just coming out of surgery, it just feels hopeless. You're in so much pain. And for me, I had back spasms. I had so much pain all over my body, and I couldn't sleep, which adds more pain, and you just can't get comfortable, and it just feels like you're always going to be in pain. But know that this season's going to pass. You're going to get the pain will be reduced over time. Once you're able to sleep through a night, you're going to feel so much better. And then just focusing on those little wins, like whatever it is. Like the first time I got my pinky to move, I was like celebrating. I was like super excited to get my pinky moving. And then like each finger, as I was able to get them just to moving just a little bit, I was like, yes, it's working. It's finally getting to move a little bit. And I was just really happy about those little things. So celebrate the little wins along the way, stay positive, and I'll share more updates soon. But that's where I'm at right now. I'm feeling really good. I'm super happy to actually be back biking and back in the gym to do some, very lightweight things. I'm doing some assisted bar dips, actually. The ones where there's like assistance, so you're not using your full body weight, but just kind of getting in the practice of doing that motion. So that's where I'm at right now, and my movement is almost at 80% of where it was before, and the doctors are really happy with my progress, and they say that I'll be able to get to 100% if I keep this up. So that's where I'm at right now. If you have any questions or comments, I'm happy to chat with you in the comment section. Take care.